The Resilient Sydney Strategy 2018 identifies pandemics as a potential acute shock that could negatively impact on Sydney. The strategy further introduces 5 directions to build resilience against such shocks. Under Direction 4, Get Ready, it identifies the urgent need for collective understanding, preparedness, and action. However, none of the related actions to Direction 4 specifically address the need to be ready for a pandemic like COVID-19. WHO lists pandemics as the worldwide spread of new diseases. They are infrequent, but when they do happen, the impact is significant. Currently, COVID-19 sees the number of infections and deaths constantly rise in Australia. With Sydney contributing to approximately a third of the country's GDP, it is imperative that Sydney has a clear plan to deal with such acute shock events. Let's take a look at 2 countries who have been commended on the way that have dealt with the pandemic so far. Singapore's CDC highlights the importance of good infrastructure for pandemic preparedness. First established in 1907 for quarantine purposes, the building has moved and improved multiple times, and most recently, in 2018, its CDC was rebranded as the National Centre for Infectious Diseases. The new NCID introduced a state-of-the-art purpose-built facility for infectious disease management and prevention. The 330-bed facility includes a high-level isolation unit, single-floor air systems, and real-time location capabilities. Supporting the NCID are 900 rapid response public health preparedness clinics across the country. These clinics serve as an intermediary between NCID, hospital, and the community, providing testing facilities at first sign of a pandemic. The NCID also represents an organization in a leadership role. The structure allows for political alignment with a centralized and integrated healthcare system. The government and the NCID has been bold and decisive in their actions in dealing with COVID-19. Very early on, they closed borders and went into a national lockdown, setting rules on social distancing and mask wearing with harsh penalties for defiance. The quick response from Singapore leaders also enabled widespread testing and a sufficient supply of PPE, all of which have been merited for Singapore's early success against the virus. Singapore has also developed effective and transparent communication methods which has built the public's trust in the government. The Doorstone framework is a whole-of-government response to any outbreak and is two-pronged. It allows practitioners to identify the level of pandemic planning that needs to be activated, whilst clearly communicating to the public what risks are present and what needs to be done. They also use WhatsApp to effectively provide daily updates and to debunk fake news to reassure its residents. Despite its proximity to the source of the virus, Taiwan is a country that has been able to maintain low numbers of COVID-19 whilst avoiding a lockdown of the country and maintaining relative economic and social normality. Taiwan has various organizations in their pandemic plan, but recognizes the need for a clear line of authority with collaboration. The NHCC is a disaster management center under the CDC that communicates to central, regional, and local authorities. The CECC is a division under the NHCC and is activated by the government in the event of an outbreak. It has the authority to coordinate orders across all levels of government in case of an emergency. These entities allow all relevant parties to understand their roles once a pandemic is declared, preventing any confusion amongst leaders while facilitating clear messaging to the public. During COVID-19, the CECC was activated early, producing and implementing a list of 124 action points covering border control, tracing, resource allocation, school policies, and business relief. One of the action points was the use of technology through Taiwan's online health systems that allows providers and patients to upload and access records in real time. When the CECC was activated, they incorporated these systems into the immigration database, allowing real-time alerts to patients' travel and contact history, identifying clustering at mass gatherings. This allowed medical practitioners to better pinpoint potential outbreaks. Taiwan also utilized GPS extensively in their contact tracing and quarantine monitoring by partnering with telco operators. In addition to quarantine monitoring, they also used to contain potential outbreaks, like when the Diamond Princess cruise docked in Taiwan. The system tracked 600,000 potential contacts, texting them and advising them to self-quarantine. Taiwan also managed a stable supply of PPE early on to prevent panic amongst the public. It set price limits on face masks while distributing free ones to residents through the NHI system. They also increased daily manufacturing of local masks and eventually announced a surplus. Now Taiwan is even donating 10 million masks to its diplomatic partners. All pandemic controls were coupled with social policies. People in quarantine received $15 a day and would receive regular check-in calls. While in quarantine, they also had access to free exercise videos and movies. So how has Sydney done? Sydney has similar pandemic preparedness plans nationally and at state level. It also has organizations such as National Centre for Disease Control in place. Collectively, they clearly identify and explain the risk of pandemics, communicating a clear strategy to all stakeholders. On the surface, the plan ticks all the boxes. However, the current framework for pandemic responses involves a myriad of agencies across various levels of government without one clear leader or driving force. Commonwealth has become increasingly involved in public health matters where states used to have control, hindering the streamlined implementation of pandemic responses. A lack of unity has resulted in confusion among the public as leaders are unable to reach consensus on priorities and messaging. This lack of leadership and direction has prevented creative solutions to combat COVID-19. First, a clear framework for the government outlining roles of each level must be implemented in the form of a CDC equivalent. This will also provide the physical infrastructure to manage future pandemics. Singapore and Taiwan have shown the key to effectively fighting a pandemic comes with swift action through clear lines of leadership as well as adequate infrastructure. Our leaders must be proactive and not reactive. Next, we must empower our people. During this pandemic, there has been inconsistent communication to the public, leading to confusion on what to do. Many times, websites have been difficult to navigate, and there has also been the issue of communication only being in English, leaving non-English speaking communities unaware. A potential solution could be to have pandemic or CDC wardens within local communities. The role of these wardens is to understand the needs of their communities and the best way to communicate and advise members on best practice, similar to fire wardens. Third, we must embrace new technology. Australia has started to adopt the use of technology with the COVID Safe app as an example. Taiwan showed that technology and its use of big data analytics have been key to its success. We have similar databases such as My Health Records that could also be used in similar ways. It can be argued that Taiwan's use of technology for tracing could raise privacy issues, and while we embrace and adopt new technology, it must be done in a culturally appropriate way. Finally, COVID-19 has shown us that there is nothing like actual experience. Singapore and Taiwan both suffered from SARS in 2003 and learnt from it. We haven't had the unfortunate benefit of too many prior pandemics. The plans and processes in place should be tried and tested and replicated through drills that would enable everyone involved to be better prepared.